Good morning and good afternoon, distinguished representatives, ladies and gentlemen. I have great pleasure in declaring the 71st session of the World Health Organization's Regional Committee for the Western Pacific open. As you all know, this session of the Regional Committee is unusual, as it is the first time we have met virtually. 2020 has been a very difficult year. I would like to propose that we begin our proceeding today with 1 minute silence for all those in our region who have lost their lives during this pandemic. Thank you very much.
While the pandemic has meant adjusting many of our specific plans, for the future vision remains very relevant today. I congratulate the Regional Director and the Secretariat for continuing to implement our shared vision in time of COVID-19.
I have great pleasure in pronouncing the representative of the Philippines, the Honorable Francisco Duque III, Secretary of Health, as chairperson.
I thank you all for electing me as chairperson of the 71st session of the Regional Committee for the Western Pacific. I have much pleasure in pronouncing the Honorable Minister of Health and Medical Services of Fiji as vice chairperson.
Ensuring equitable access to vaccines, diagnostics, and therapeutics is not just the right thing to do. It's the smart thing to do to catalyze the global economic recovery. But we cannot wait for a vaccine. We must save lives with the tools we have at hand.
COVID-19 is the most challenging public health event we have seen in 100 years. And it's testing not only the capacity of our health system, but also the resilience of our societies and economies. 2020 has been a very difficult year. I began this speech by talking about my feeling of sadness for those who have lost their lives. But when I reflect on this year, I also think with the great gratitude and humility of the millions of health professionals and other essential workers around our region and the world who have continued going to work every day to look after the sick and to keep the rest of us safe. I also feel pride in WHO and the Ministry of Health staff in the countries who, with the care and compassion, have been working so hard on the response, often at their considerable personal cost. I ask you to join with me in a moment of applause as a sign of our thanks.
Thank you for all your work to continue driving forward implementation of that vision in the time of COVID-19 as we work together to adjust to a new normal and create indeed a new future.
In many countries, immunization programs do not reach adolescents, adults, and older people.
Populations in the Western Pacific region are aging rapidly.
Safe and affordable surgery is essential to achieving universal health coverage.
Ready to fish, ready to fish. Fishing.
As we navigate our ways through the COVID-19 era and beyond to advance our vision for the future, These are the values that I hope will continue to guide us. Humility, compassion, support for the vulnerable, and solidarity.